Welcome to A Balanced Life on the Go. I'm Dr. Nicole Lindsay, your host on this podcast, along with Dr. Brian Jeanette. This is a podcast designed to help connect you to a more balanced life on the go. Each week, we will bring you simple, concise, and easy to implement ideas, tips, and strategies to help you connect to better nutrition, movement, and thinking so you can achieve balance in your busy life. Isn't this what life is all about? Trying to achieve balance so that we can be healthy, happy, and live to our fullest potential. We're glad you joined us. Let's get started. Hi, everybody. Welcome. I'm Dr. Nicole Lindsay.
And I'm Dr. Brian Jeanette.
And we are here at Back in Balance, and we are excited to be here because it's been a while.
Yeah, it has been a while. Today we want to kind of kickstart back doing these Facebook Lives with you guys. Today we're going to talk about symptoms of thyroid and other endocrine imbalances.
Yes, the thyroid hack, the lowdown on the slowdown. You know, we get to a certain age and some of our body parts get sluggish, and we're going to talk about that, why that's happening, and we chalk it up to
old age.
I'm getting old.
Yeah, and while that's true, I mean, obviously all of us age.
Speak for yourself.
Yeah, I don't age. I mean, obviously, I don't age. But we all just have wear and tear on our body, and if you don't do a good enough job of maintaining your body, treating that wear and tear, treating the maintenance like it's a high performance like the high performance engine that it is, of course it's going to slow down. Of course things are going to stop functioning properly. The thyroid gland is no different, and every single muscle, every single organ, every single cell in our body depends on an adequate supply of hormone levels or thyroid hormone levels for achieving and actually maintaining its optimal function.
Yeah, so you may be thinking, I don't know, maybe I have thyroid issues, maybe I have an endocrine imbalance. Maybe you even mentioned this to your family doctor at your last physical, and they ran a thyroid panel, and
everything was in with normal range.
And you're told you're just getting old.
Yeah. Right?
Or maybe that you're just told, okay, everything's normal, and that's great. That's a good thing to have is a clean bill of health after a physical. But if you are experiencing some of these symptoms, which we're going to list off, this may indicate that you have a thyroid problem that has not quite gotten to that point that's detected by some of the blood tests that are typically done in a standard panel that you have when you have a physical.
These symptoms that we experience as humans are so vast and so broad. Acne, allergies, we can have chronic fatigue or just generalized fatigue, constipation, eczema, dry skin.
Hair loss, headaches, heart palpitations.
Yeah, which that gets pretty serious, and then you start to go down to mental disorders or brain disorders.
Infertility.
Memory loss, muscle weakness.
Intolerance to cold, intolerance to heat, low blood pressure.
Mm-hmm. You have metabolic stress, so you're either gaining too much weight and can't lose it, or you end up losing too much weight and can't gain it back.
PMS, psoriasis, premature aging, real brittle nails, rigid nails, changes in that. If you notice that, that may be a sign.
Yeah, headaches, actually insulin sensitivity or too much insulin in your blood.
So these are some of the symptoms. Not all, that you may be experiencing when your thyroid is not doing what it needs to do. So what is your thyroid? What does that look like?
Yeah,
it's
every person knows where the thyroid is at least, but we don't know necessarily what it looks like and the main functions that it has.
Yeah, it's that butterfly-shaped gland that is right here in the lower part of your neck in the front. And it is responsible for lots of critical functions in the human body.
So let's talk about what it means to have an underactive thyroid or have a hypothyroid state. So your thyroid gland releases many hormones and many chemicals. An inadequate amount of these hormones and chemicals in your body causes a decreased function of every aspect in the body. What this does is this actually causes a higher demand on your thyroid gland.
And the opposite is true when your thyroid is functioning at a hyper state, or hyperthyroidism. The thyroid gland is releasing excess amounts of thyroid hormone to try and keep up with the demands, and this results in an elevated metabolic state.
And if you have too much demand on a certain body part, too much demand on a certain engine, too much demand on anything, eventually what's going to happen is that it's going to start to wear out and fade and break.
Definitely. Yeah, that goes for every single cell of your body, your glands, you, ultimately.
Yeah, absolutely. So how do we test if we have thyroid problems? In Western medicine, the standard panel is just actually testing your TSH level, or your thyroid stimulating hormone. This is the blood test. So each doctor that you go to, they're going to have their normal range, right? So it's going to be approximately from like 0.5 to 4.5 milliunits per liter, right?
Yes, and so this, however, it only identifies 2 to 5% of what's happening in your thyroid gland. So, and this, a Belgium endocrinologist who goes by the name of Therese Hertog, I'm going to pronounce that wrong, possibly, he stated that the TSH, if you're going by that only, it's missing a whole lot. And this has been the gold standard for 30 years plus, but it only identifies 2 to 5% of what the thyroid gland is actually utilizing.
Right. So a perfect analogy for taking this snapshot in time is if you go sprint your absolute hardest you possibly can for 30 seconds. Your blood pressure is elevated and your heart rate's elevated. Then immediately go get your blood pressure and your pulse checked, and your doctor says, "Oh, your blood pressure is 180 over 90 and your pulse is 175. You are going to have a heart attack. We need to put you on cholesterol medication. We need to put you on blood thinners. We need to go in there and do surgery right now." That's what this snapshot, that's what this blood work in time is telling us. This very small window of our activity. Not through our whole life. When you get done exercising, your heart rate comes down and your blood pressure comes down, you're normal, you're healthy. Your doctor doesn't see that, or we don't see that when we test it. So we need multiple tests and looking at multiple different avenues.
So the point here is that there's other ways to look at your thyroid gland to see if it's healthy. Testing your TSH, what we do in Western medicine, is only one way. And it is not always enough to give a full picture of how your thyroid is actually functioning. So if you are experiencing some of those symptoms that we rattled off, and you've been told that your TSH is normal and that your thyroid is therefore normal, your thyroid may not be functioning normally. So the holistic approach to looking at your thyroid and testing your thyroid is a multifaceted approach, and there's several things that need to happen. 4 things in particular that we're going to talk about over the next few minutes. The first thing is, in addition to the TSH, you want to do a more encompassing panel. You want to look at also T3 and T4, not just TSH.
Absolutely. You also want to take an extensive medical history. You want to look at your nutrition. Do you have any nutritional deficiencies? How is your zinc? How is your iodine levels? What about your selenium, your vitamin A, your vitamin B, your vitamin D, C, all of them. So we want to look at those. We want to look at what kind of medication that you're taking. Are you perhaps taking birth control? Are you taking beta blockers? Are you taking some sort of hormonal supplement like estrogen or testosterone? Steroids, for example.
Yes, and going back to, just quickly going back to on the T3 and T4, not to get too technical, but just so you understand or start to get a little understanding and knowledge of why this is important, that you need to look at them in addition to TSH, is that T3 is what's considered your active thyroid hormone. This is the hormone that gets inside of your cells and runs the metabolic machinery.
It's what your body uses.
Right. So we need to know that. We need to know if T3 is normal in your blood. TSH is more reflective of T4. So we don't want to leave T3 out of this picture. We want to know what's active, what's happening in that thyroid.
you could have a normal blood work, a normal TSH level in blood work, but that might not translate to your body actually using that. You have a high level of reserve, but you're not using it. So a big savings account, but a small checking account.
Exactly, yes. So yes, the first step is a full thyroid panel. The second step, as Dr. Brian went over, is a very thorough medical history, looking at the meds, your nutrition, your diet, and other things, other health conditions and things. The third thing is taking your basal metabolic temperature. You can do this, something simple that you can do yourself. And what you want to do is for 5 days in a row, you want to take your temperature upon waking. And you want to do this in your armpit for 10 minutes. So what the sources say to do is take your thermometer and have it ready on your nightstand. And then when you wake up, before you do anything, before you let the dog out, before you brush your teeth, before you do anything, just roll over, grab that thermometer, stick it in your armpit, and just hit snooze. 10 minutes. And do this for 5 days in a row. And that average number is going to be your basal metabolic rate. So your normal temperature is 97.8 to 98.2. If it's anything less than that, you're going to have hypothyroidism. Okay, that's another way to test. It doesn't mean that yes, if it's low, that's it. You want to look at the other things that we talked about as well, the full panel blood work and the medical history.
Mm-hmm. All this is a game with puzzle pieces that we have to match together. Because the fourth thing that we have to do is we have to actually do a physical exam. Take a look at the physical attributes of a person. Looking at your age. Looking at, do you have diabetes? Do you have any physical attributes of diabetes or metabolic disease? Age, stress, we talked about obesity. Do you have any surgeries? Are there any other types of cancers, any other types of issues that we've had around the neck that could be affecting the thyroid gland? Or other glands that we'll get into, kidneys, adrenals, pituitary, hypothalamus gland, all up in your brain.
Yes.
Looking at your eyebrows, looking at actually your eye sockets themselves. All of these things tell us how well your thyroid is functioning. Probably one of the main things that we can look at with thyroid issues is, like I said, your eyebrows. Do you have nice, full, thick eyebrows, or are they starting to erode in, and the outer third of your eyebrows are gone, not there anymore? Mm-hmm. That is highly, highly indicative of thyroid problems.
Yes, and also swollen eyes under the eyes, puffiness under here.
Big bags.
Again, it's not just age. It's not that you're getting old. It means something. It means something. So that's also a sign. Okay, so what do we do? So what do we do if we know that, yes, I do truly have hypothyroidism?
Drugs.
Right. That is typically the gold standard for Western medicine. Again, conventional treatment is to give synthetic derivatives of T4, such as Synthroid, and this is to tweak the TSH levels.
Typically, this is not inherently a bad thing, but we have to make sure that T4 is then going to be able to turn to that active form of T3. Again, you can have high reserves in the body, but if your body can't use it, it doesn't matter.
Yes.
If your body can't use it, it doesn't matter.
Yes. And there's a problem when you're only looking at the TSH and you're only treating that with synthetic derivatives of T4, you're not really paying attention to whether that T4 is converting into that more active thyroid hormone, which is T3. So we're only treating the T4, the TSH, when we use conventional treatment.
Absolutely. And this is actually kind of branching away from this. This is actually an issue for a much bigger problem that we face in our society. There are inactive forms of vitamins and there are active forms of vitamins. And a lot of supplements, some medications give you the inactive form and rely on your body to take that inactive form and make it active. So if we have a problem, if there's a system in our body that's not working properly to make that inactive active, it doesn't matter how much supplement you take, it doesn't matter how much medication you take, it's not going to work.
Yes, exactly. So what's the other approach? How else can we treat or correct and in some cases completely reverse hypothyroidism, well, there's holistic treatment. And that, again, is a multifaceted approach. There's several things that we want to do. And the first thing we want to do is we do want to look at the entire pathway, starting from TSH to T4 that gets converted to T3. We want to look at this whole process, not just one section of it, not just the TSH. Okay, it's only one part of the puzzle. So we want to look at the full thing. Okay, so finding a healthcare provider, an integrative provider, there's several in the Asheville area. If you're in Asheville, we'll be happy to give you their names that we work with and we refer patients to. Yeah.
So the other thing we have to do is we have to really do a close look at your diet and maybe do an overhaul of your diet. Are there other medications that you're taking that could be interfering and blocking that pathway for inactive to active? And also nutritional deficiencies. Are you deficient in some mineral, some enzyme, some vitamin that is stopping that conversion from happening?
Yes. And then the third step is to add some desiccated glandular products which is a supplement to your regimen. And examples of these are going to be like Armour Thyroid, Nature Thyroid. You've probably heard of these before. These are heat dried, hence the desiccated. They are pig derivatives, so you're going to see bovine listed on the ingredients, and it's the closest version to what we have in our bodies. They've been used in Chinese medicine for many years with great success. We use Standard Process as our company that provides these products, and they're amazing. We have fantastic results with these supplements. But you can get desiccated glandular products. You can get them T4, active T3, T2, T1, calcitonin, selenium. All of these supplements are going to help.
Some of the other things that we can do is actually have a thyroid replacement option. Excuse me. So one of the first ones, that's the most popular that a lot of people have heard of, is Synthroid. Right. This is a very common prescription based. Levothyroxine is the other name for it, and this is actually T4. But again, we have to make sure that our body can take that T4 and convert it to the active form of T3. Like Dr. Nicole already talked about with some of these desiccated adrenal products, we can combine them. We can combine that Armour Thyroid supplement. We can combine this Synthroid where it's T4 and it's T3. That's so your body has a reserve of active ingredient and then a reserve of the inactive form that can then go to that active ingredient.
And listen, this is definitely not something that you want to play around with yourself. This is a very complicated thing, and it's not a one-size-fits-all. You really have to work with somebody that knows what they're doing.
Absolutely.
So we're not in any way trying to tell you to do this on your own. We're just bringing to light the fact that, number one, you may have a thyroid problem that you suspected you did, but were told that you didn't, that everything checked out fine because your TSH was only checked, but you in fact do. And number two, that you probably need to see an integrative functional medicine doctor to get more help to get this dialed in for you.
Yeah, and listen, the way that this goes and the way that the human body goes and all of us go, we inherently know that there's something going on with us, like whether we admit it or not. So then when you get your blood work back, and your Western medicine doctor says, oh, it's within normal range, or the lab work comes back, and on that lab sheet it says it's within normal range, and you're like, well, something's wrong with me. I know that there's something wrong with me. I haven't been this tired before in my entire life. My hair hasn't been this dry. My skin hasn't been this dry.
Been there.
Yeah, push it. Ask more questions.
Yes, become your own advocate.
Become your own advocate, and then seek out professional help somewhere else. None of us have all the answers for everything, and so having you do research and having you know that there's other options out there, then you can take that and seek out help.
Yes, and we're going to talk about hyperthyroidism next. We just talked about hypo. Let's talk about hyperthyroidism. But here's a story. This is a true story. 36-year-old woman starts to experience, after lots of stress, decade of intense stress and drive personality, starts to experience problems with sleep, which she never had problems sleeping before, but terrible insomnia for 6 months plus. Basically couldn't gain weight, felt anxious, felt heart palpitations, really was getting nervous about all of these signs and symptoms, hair falling out as well, lots of hair loss, and basically went the whole gamut of doctors ruling out all the big, bad, and the uglies because it started to get scary. What the heck is going on? And TSH checked out normal. Everything else checked out normal, and was told that you're getting old by your OBGYN, your family physician, 2 family physicians, and rheumatologist, and that you just need insomnia, you need sleeping medication and anxiety meds, and you need to go have fun with your girlfriends. And this was me. And I was 36 years old. And fortunately, I hooked up with some wonderful integrative doctors, one of which is Dr. Hedberg, who's a colleague, and I will be glad to put his information in the link of this Facebook Live. And he ran all these this blood tests on me, looked at my deficiencies, and it turns out that I had Hashimoto's thyroiditis, which is an autoimmune thyroid disease that basically can fluctuate back and forth from hyperthyroidism to hypothyroidism, and it's one of the causes of hyperthyroidism. So fortunately, I got the help I needed, and I hooked up with another integrative doctor as well, and through the help of them with making some changes, a lot of changes to my diet, my lifestyle, my supplements, and getting on some compounded natural hormones, thyroid hormones, I was able to get my life back, and it changed me dramatically. I don't know where I would be if it weren't for those people helping me. So that person is me. So hyperthyroidism, too much thyroid hormone.
Dr. Nicole already talked to you about some of the symptoms that are involved with this. Nervousness, sweating, heart palpitations, nerve tingling, so nerve problems, lots of fatigue, going back between being hyper stressed out and a lot of nervous energy to very, very fatigued. Heat intolerance, you get really hot and you can't really tolerate the heat. Hyperactivity, eye disorders, and increased appetite are among the most common symptoms of hyperthyroidism.
So the causes of hyperthyroidism, like I said, typically it's an illness that can lead to your thyroid kind of burning itself out. And some of these illnesses are going to be, like I said, Hashimoto's, which is an autoimmune thyroid issue. Graves' disease is another illness that can lead to hyperthyroidism, and other autoimmune diseases as well.
Right, so we know that autoimmune diseases is what happens when the body starts attacking itself. Right, you have an issue. You have some sort of potentially infection. You have some sort of antigen that's floating around in the bloodstream. Your body then produces antibodies to fight that. Right, so Dr. Nicole has she's very gluten intolerant. She has a lot of the symptoms that come back rearing their head if she has too much gluten. So what happens is she ingests gluten, her stomach doesn't like that, her intestinal tract doesn't like that, she gets leaky gut, this goes out into the bloodstream, the body then produces antibodies to fight that gluten. So these antibodies attack that gluten molecule. Gluten's taken care of, gluten's gone. But guess what happens? Those antibodies stick around. They stay there. They don't immediately stop, die, and dissipate. They stick around looking for other invaders. And they're looking actively for other problems. So what happens? They travel around your bloodstream. In the case that we're talking about with thyroid, guess what? Your thyroid gland, or the cells in your thyroid, might look suspiciously close to a gluten molecule. So what happens? Those antibodies then attack your thyroid gland. Right? Those antibodies stop, they die, they're no longer ineffective, but you continue eating gluten. She eats gluten the next day. Same exact thing happens. Your body recognizes that gluten molecule, and then those antibodies, bam, they're produced right then and there. and they start attacking that gluten. But guess what? That thyroid gland still looks like that gluten molecule. So then it starts to attack it, and eat away. This is not an overnight process. The glandular disorders, autoimmune disorders, do not happen overnight. They can take many months to many years for full-blown autoimmune diagnosis. So what happened, what Dr. Nicole was experiencing, this was building up long before she ever experienced any symptoms, and much longer before they even be able to come to a diagnosis of that.
Yeah, and what's crazy is that most autoimmune disorders have an infectious etiology. So basically, you get some kind of virus or infection, and that could happen 10, 20 years ago. For me, I think I trace it back to a trip to Mexico. Don't we all trace something back to it? But
supposed to leave that kind of stuff in Mexico.
Exactly. But really, all of us that went on this trip all ended up with a very contagious virus, and it was terrible. Many of us ended up in the emergency room. We couldn't hold down water for days and days and days. And something like that, getting a virus, and it may not be that intense of a virus. It may be something like candida or fungus or strep, staph. Many mycoplasma disorders or infections can lead to an autoimmune disorder.
One of the more common ones, Epstein-Barr virus.
Yes, something you may have had as a teenager that stays in your system, and years later, if it's not taken care of, it can turn into an autoimmune disease for you. So this is, and the reason why we're mentioning this is because if, again, you are showing signs of hyperthyroidism and you really want to get a handle on that, having a good functional medicine and integrative physician who can test you for all of these infectious agents may be able to finally treat that infection, that virus, may be able to eradicate that to help put the fires down or completely out in your body, your autoimmune disease, so then that your thyroid can actually heal. Because without that, if infection still lives, then
it's going to come right back, and your body's going to have that same immune response. And there are a lot of other conditions that have, or a lot of other autoimmune conditions that have these infectious etiology timelines, right? So Crohn's disease, ulcerative colitis. A lot of people get diagnosed with irritable bowel syndrome, ulcerative colitis, and Crohn's disease. And the most popular treatments for Crohn's disease and ulcerative colitis are biologics, like Humira, Remicade. And I remember getting diagnosed with ulcerative colitis 6 or 7 years ago, just like randomly, just like boom, I had it and I was in the hospital for it. And they're like, oh, let's put you on this biologic, Humira. Okay, let's do it. Fine. I mean, one treatment is only, at the time, was only $64,000.
Whoa.
So they make a lot of money off of that. That's just okay. I digress. But one of the most common side effects of that drug is developing lymphoma.
Yeah.
So you're going to take a medication that's going to stop your immune system, stop your immune function, so you stop having stomach pains, bleeding, all this stuff, but then only to be at a higher risk of developing other types of cancers.
Yeah, crazy. So again, complicated, yes, but it can be resolved. There is help for this. Another thing that causes damage to your thyroid, which could lead to hyperthyroidism, is iodine deficiency. This can cause a lot of oxidative stress, and we know this. We've been putting iodine in our foods because of this, in our salt and things. But again, it may not be why you have hyperthyroidism. So you don't want to just go and get an iodine supplement or start eating an obscene amount of food with iodine because, I think that can fix hyperthyroidism. No. But we're just telling you that could be one of the ways that you damage your thyroid.
Absolutely. So I think we've iterated this a few times. The treatment for thyroid problems, they're very complex. But the first step that needs to be taken is finding the underlying cause first, right? That's the most important thing. Is it from stress? Is it from lifestyle? Is it from poor nutrition, poor sleeping, inadequate management of stress disorders, right? So the number one thing that we have to look at is find that underlying cause.
The next thing is to really get your diet situated. And one of the best ways to do that is to do a detox. If you've never done one ever in your life, start there. Because most of us have toxins built up in our tissue, in our glands, in our organs, in our cells, and we really need to purge them once in a while. I personally like to do a 10-day detox once a year. And if I travel, now I'm going to do it again when I get back. But doing a 10-day detox at the very least, we can help you with that. If you want more information on that, let us know. We'll help guide you through that. But that's the next thing that you do.
Following that, you want to look at some of the medications that you're taking, right? Whether you're taking beta blockers or whether you're taking other cortisone creams or other types of steroids. Talking to your doctor about interaction that those medications might have. And actually talking to your pharmacist too. I mean, your pharmacist, that's their main job and main purpose is to look at how medications affect the body and drug interactions, right? So asking them different, how these drugs can affect my body in different ways that are unintended.
And then the next thing is definitely don't forget about your adrenal glands. Now, if you follow us, you know that we have done Facebook Lives on the thyroid gland. We've done a podcast on that. If you haven't listened to that, you want to know more, please listen to them. But your adrenal and pituitary hormones, they really have a synergistic effect on your thyroid. And your adrenal glands control so many things in your body and so many processes. So I always like to start there, especially if you've never done any adrenal work. I'm right there with a detox. You want to make sure you give your adrenal glands some attention. They're the glands of stress, and they produce hormones that play a part in the thyroid. They all interact. So if your adrenal gland is not functioning well, it's going to lead to poor conversion of T4 to T3, and there you go, thyroid issues.
There's an incredible web that is weaved all over our body with different glands, talking with other glands, producing different chemicals. And this is a very, very sensitive balance. And if one of these scales is off, that balance is going to be off. And if that balance is off, we're going to have some sort of symptom that manifests itself. The longer that we're around, the more likely that the imbalances are going to happen. The longer that we're around, the older that we get. And so we just chalk it up to age. But we have to balance these scales.
Absolutely.
And we can balance our scales.
We can, yeah, contrary to popular belief. So there you have it. I think we covered a lot on all the different options, the way that you can test from a holistic standpoint your thyroid gland, the fact that you may want to pair up with an integrative doctor. Let us know if you need some names. And also do a detox, give your adrenal glands some attention, and clean up your diet, get rid of refined stuff, toxins, and eat healthy, organic. But we always like to leave you with one thing.
So actually, Dr. Nicole's going to leave with one thing, and I'm going to leave with one thing. The most important thing that we want to leave you with is if you want to know more information, contact us. So my one thing for you is that I want you to contact us if you want to know more, so we can get you in touch with an integrated provider or a functional medicine provider.
Absolutely. My one thing for you is to do yourself a favor and detox yourself. Start there and then see how you feel after that. So put yourself through a 10-day detox. Let us know. We will help you. We'll give you information on what you need to do. You can look back through our Facebook Lives and our podcasts. We do have information on this where we go into detail. But that is what we want to leave you with today. So we hope that you enjoyed the thyroid hack, the lowdown on the slowdown in the body, and what you can do to rev your body back up and get it back in balance.
Right on.
Thanks for listening.
Thank you.
Have a great day.